my name's Demi. I'll be the student nurse that's working with you today. Can you tell me your name and date of birth? Good, I see that on there. Just coming in to do a dressing change. You don't have any allergies, correct? Awesome. Let's get this wiped down and then I'll take a look at your port. Not having any pain today? Good. So right away I know we're working with an implanted port. I can see we have the BioPatch on there. Don't see any redness, swelling, no drainage. It's not warm to the touch at all. Everything looks good. We have our needle, which is still in place. We're clamped and saline locked. We have a PosiFlow, which some facilities have swab caps that they can put on the end, but for practice purposes, we just have the PosiFlow. We don't actually have a dressing on here, which some facilities, they have what they call a shirt and pants. We have the shirt that goes on the top and the pants goes at the bottom, and then the tubing goes through the notch, so it's not being tugged on at all, and we try to stay away from the nipple. So if we were removing that right now, and it was a little bit tricky, some things we could do is use alcohol, kind of loosen up the edges so it's not so rough on pulling. We can secure this with some tape or hold with some gauze so that we're not pulling the needle out, which is what we're really worried about. We want to make sure that we're not using scissors so we don't cut it at all, and we really just want to make sure that that needle stays in place. So what I'm going to do is I'm going to go ahead and remove the BioPatch. Then I can just throw that right in the garbage. Then I'm going to take my gloves off, alcohol, then I'm going to go ahead and set up my sterile field. So I have my tray and my BioPatch. So I'm going to go ahead, I'm going to put my new gloves on. And I checked and everything is in good expiration. So I can go ahead, open this up. And here I see I have my mask for my patient. So I'm gonna have them put that on. If for whatever reason they didn't want it on or couldn't have it on, I can just have them turn their head and face away from the port. But I also have my sterile gloves. I'll set those to the side since I don't need them right now. I'm gonna go ahead, take that out. I'll go ahead and just toss that right in the garbage. Go ahead and open it up. Open it to the side, to the other side. And pulling this outward, making sure it all stays sterile. Then I'm going to take my BioPatch, making sure this also stays sterile, and just kind of flipping it on, just like that. Okay, so now that I have that all set up, I'm going to go ahead and put my sterile gloves on. Go ahead and take my gloves off. Alcohol. Okay, now making sure I don't have my back turned to my patient at all and that my sterile field stays in my site. So I'll go ahead and put my sterile gloves on. Starting with my dominant hand, making sure I lift up, pull back. Putting on my non-dominant hand, again lifting up, making sure I'm not dragging it, keeping my thumb on my dominant hand up so that it doesn't contaminate on my wrist at all. Okay, so now my hands are sterile. I want to make sure I'm keeping them above my waist, and then I'm facing both my patient and my sterile field. So I can go ahead and I can grab my ChloraPrep, and I'm going to start cleaning it horizontally for 30 seconds. Picking this up a little, getting underneath, getting it nice and clean using friction. It's a little trickier to do it once we have the needle in, but we still want to get it as clean as possible. Go vertically. Is everything still feeling okay? Good. Okay, now I'll do my best to do concentric circles. It's a little bit tricky. And again, making sure my sterile field stays sterile, not reaching over or crossing with my elbow and all. I want to make sure we cover all of the area. I'm going to go ahead and clean my tubing for 30 seconds. We really want to make sure everything that's underneath the dressing gets nice and clean so that there's no contamination or bacteria or anything that's sitting underneath the dressing. And lots of friction. Okay, so 30 seconds has passed, so now I can go ahead and just drop my ChlorPrep. So now what I'm going to do is I'm going to take my BioPatch and keep my blue to the sky and just place that right behind the needle, just like that. So then after that, I'm going to take my dressing, and this isn't the typical dressing. What there is there's the shirt and the pants, but we would put our transparent dressing on just like this, and then the shirt and pants would have a notch, so we just want the tubing to go through the notch, and that would be it. So then I would want to document. I want to document that I put a new BioPatch on, that I have my new dressing on there, that my site looked good, no redness, swelling, pain for my patient at all, there's no blood in the line at all, and that everything just looks good. I'd also want to note if this was capped or infusing, but ours is just saline locked and no swab cap for practice purposes. So I want to make sure that I am disposing of everything in the proper places. There was no blood, so I didn't need a bio bag at all. So I can just throw everything in the garbage. I'll take my gloves off, do hand hygiene, and that's it.